I'm going to begin with my QSIN for Mrs. Black. So I will check the wristband, the name, date of birth, the whiteboards, and the patient, make sure that the patient's and the staff's names are correct. She is on 4 liters of oxygen currently. So I would check the flow rate and check her nares for any skin breakdown, her ears. No feeding tubes, no abdominal tubes, no chest tube, no trach, and no Foley currently. She does have an IV in, so I would check the patency of that and for any redness, swelling, tenderness, and any warmth, any drainage, anything like that. And then again, I would check for make sure that the side rails are up if needed, and that the bed is in a low position, the call light's within reach, no obstacles, no clutter, and then a water pitcher available if needed. So now I'm going to leave the room and come back. Alright. I'm going to do my assessment now. So during this assessment, since Mrs. Black is she won't awake, she's not very easily aroused, it would be easier to ask the husband questions for certain questions that I have to ask. So I am just going to go ahead and take my vitals. So use this as my thermometer, take her temp and pulse ox at the same time. So her temp is 101, her pulse ox is 89, which is pretty low. So again, I would want her oxygen to be above 92. So since it's at 4 liters right now, we could bump it up to 5 liters, but also be sure to watch her very closely if the oxygen is higher than normal. The flow rate, oxygen. So I will then take her heart rate and watch her respirations as well. So her heart rate is pretty high, 145, very high. Her respirations are 32. I'll go ahead and take her blood pressure. Her blood pressure is 120/76. So again, she is A&O times 0. We do a sternal rub, and she'll arouse a little bit, but she is very minimal of a response with that. So she is just repeating her husband's name though, but she will not answer any questions, even if we're yelling or actually physically touching her. Still nothing. But I am going to go ahead and do my assessment on her. So I'll start with looking at her eyes with the pen light. So I am noticing some redness in her eyes, and there is puffiness around her eyes as well. Since I forgot to mention that she is on a vent with my QSIN, so I would check the vent patency and all of that as well. Back to the assessment though, I would ask if she's been having a cough, but I'm going to ask the husband that, so I would ask him if she's been having a cough, and he is saying that not that he knows of, that she's been having a cough, and non-productive cough, no cough at all, so there's no sputum or anything because she's not coughing or anything. So then I'll just feel her skin right now, do like a skin assessment, her arms. They're a little warm, kind of moist just a little bit, but I'm going to go ahead and take a listen to her lungs. And I'm going to listen to her back too. I'll just have to pull her up. So her lungs have crackles bilaterally, but again, the vent, they're even because of the vent, but there are crackles in the lungs. So I'm going to listen to her heart now. Okay, with her heart, you can hear the S1, S2, but it is very rapid and irregular heartbeat. I'm sorry, it's irregular, so the S1, S2 is off with the irregularness of that. But I am going to go ahead and listen to the abdominal area. Alright, so I did hear abdominal sounds in all 4 quadrants. I'm going to go ahead and palpate too. Now she can't tell me if she's having any pain because of the, she's unconscious, but I'm just going to palpate just to feel. So I would want to ask when her last bowel movement was, so I would go ahead and just ask the husband, do you know when her last bowel movement was? And he went ahead and he told me that it was 2 days ago, so I will be sure to note that as well. And then I would document that assessment, and then I'll make sure the call light is there just in case for the husband as well. I'll just leave the call light there, and then I'll be back in just a little bit. Alright, so I am back. The doctor did order propanol IV push for her, so I'm going to go ahead and administer that. So I would begin by washing my hands. Again, I would check her name and date of birth. I would ask the husband, can you tell me her name and date of birth, just to check too on that. And then I would check for any allergies as well, if she has any allergies to any medication, which she does not. So I'm going to go ahead and I have my medication, my saline, and my alcohol pad as well. I don't have a line, but I'm just going to use my piggyback line just to show what I would do. So I would put gloves on after I wash my hands, and then I would take this off and wipe with alcohol pad. I would take my saline and normally would attach it, and I would push about 5 milliliters of saline through the line to begin. While doing this, I would also be watching the IV site, make sure that there's no redness or any, make sure it's patent and all that. Okay, so I did the flush of saline. So now I'm going to take off my cap and use my medication. So propanolol. It is 10 milligrams over 5 minutes, so I'm not actually going to do it over 5 minutes, but if I were actually doing this, of course I would do 5 minutes. So this is a slow one, so you would just go very slowly with this and make sure to do it over the entire 5 minutes. That is very important because you don't want a sudden drop in the blood pressure, and you want to make sure that during this you're monitoring the blood pressure to make sure that it's not a super sudden drop of the BP. It is also important to note the side effects of this medication, including fatigue, weakness, dizziness, diarrhea can be a side effect. It'd be important to educate your patient on that. Again, I would be educating the husband right now because of the patient is not arousable currently. But it's also important to assess for a rash when giving this, and it's very important to monitor INO while giving this medication as well. Okay, so we'll say that it's been 5 minutes that I've been pushing. So I will do my saline one more time. It is very important to not push the saline too quickly after you give the medication, because you don't want to push the rest of the medication through the line too quickly. So again, I'm just going to push this saline, pretty slowly over a couple minutes or so. And again, still watching the IV site and the patient's reaction, even though she is unconscious, it's still, or I guess somnolent, it's still important to pay attention to that. So again, pushing this slowly. Once that's done, I'll just put this cap back on. I would discard my needle and the sharps and throw this away. And I would leave the collate again within reach, and I'll be back to check on her again to see how the medication is going. Alright, so now it's also important to make sure that we talk to the husband about hyperthyroidism, just so that he can get a little bit better of an understanding about it. So in the history, he did tell us that she takes propylthiouracil for Graves' disease, which is related to hypothyroidism. In this case, it's important that she does take that every day, and that she does get the blood test done pretty often to get her levels checked as well. Again, the thyroid storm, which is what has happened to his wife, it would be important to explain to the husband that this was caused because when a big stressor happens in life, especially when diagnosed with she's diagnosed with Graves' disease, which is related to hyperthyroidism. When a big stressor happens, which in this case, she was pregnant and she's in 2 weeks postpartum, which is a big stressor on the body. This can lead to increased metabolic rate, which is causes an excess of TH, which is the thyroid hormone. And then this leads to those symptoms she was having, where she was not easily aroused, wouldn't answer his questions, and then pretty confused. So it is very important that he brings her in to get that checked, because it can lead to death eventually. And it's a good thing that he did bring her in. And then I would make sure that the call light's available again, and then I would leave the room and then come back in a little bit to check on her. Alright, so at this point, I'm just back to check on the patient, check on the husband, make sure everything's okay, because I will be leaving my shift and I will be reporting off to the other nurse. So on my report off, I would state that Mrs. Black, she's a 31-year-old female. She is 2 weeks postpartum. Her husband brought her in because she was confused and very difficult to arouse. She has a history of hyperlipidemia, Graves' disease, and asthma. She does take simvastatin and propylthiouracil daily, and she does have a rescue inhaler. I did note redness in the swelling of her eyes, the rapid heart rate, the crackles in the lungs, and then we did do laboratory tests on her, diagnostic tests, which I will go over in a bit. But I did give her propanolol IVP. That was over 5 minutes. She did tolerate that very well. And then I did talk to the husband about what the thyroid storm or the thyroid crisis is, and how to prevent it, and to make sure to know when to call the doctor and what to do if it is happening. So education was done on that patient. And then I would just go over the laboratory tests on my own, just to get a full understanding before talking to the patient about this. So again, she did have an EKG done, CBC, ABGs were all done, and it's important to be able to understand those. So with the ABGs showing respiratory acidosis, which is again the too much carbon dioxide in the body, her magnesium levels were a bit low, which is normal with hyperthyroidism, but again, it's still important to know these things. Her metabolic rate is overall increased, which leads to that sympathetic nervous system increase, and then that would be why her heart rate was so high, and her cardiac rate and her stroke volume were high as well. So it is important to understand the lab tests so that you can explain them to the patient as well. So that's just a little add-on for that. And then I would go ahead and leave my shift if the nurse had no questions and the patient was in a good position with the call light and nobody had any questions. I would go ahead and leave my shift. I'm going to do that. I did want to add on though that I would need to do the normal saline at 100 milliliters per hour. After the propranolol was given, it is ordered to give the normal saline. So I'm going to go ahead and do that in a new video. I'm just going to do the normal saline at 100 milliliters per hour. I'm going to add that into a new video after this one. Okay, so this is my video of doing my 0.45 normal saline, hanging at 100 milliliters per hour. I did want to note on my previous videos, when giving my medications, IVP, I would have taken it out of the vial before and made sure that the vial stays with it so I know the medication that I am giving is correct. I didn't show that in my video, but I would do that, just to be clear on that one. So, again, I don't have the correct tubings for this, but we're just going to say is our 0.45 normal saline bag, and we're going to say that this is our line. So I would begin by just making sure that I do have the correct name and date of birth with the patient and any allergies, just to be safe. I would put the sticker on the bag with the patient name, the drug or what I am giving her, the amount, the date, the start time, and the flow rate. So I would begin by washing my hands, putting gloves on. This would be hanging. It would be a bigger bag. It would be hanging. So I would take this part off, clear that away, take this off, and I would spike the bag with this, putting that in. You would squeeze the drip chamber until you get about halfway full with fluid, and then while this is hanging, you would take this off and let a little bit of fluid out just to make sure the trash can and it's good. So this would be hanging, and this will then be attached to the IV port, and it would go through a pump which would be set at 100 milliliters per hour, 100 milliliters per hour to run, and it's just important to check the IV site and make sure that it's patent, no redness or anything with the patient, and then it's important to come back and check on the patient as well later just to be sure. That is just the normal saline that was the doctor had ordered for the patient.